Since 1990, we have spent millions of euros and tens of thousands of research hours to find scientific answers to life's most important and challenging questions. What makes us happy? What makes us healthy? How can we heal from physical and mental disease? How can we heal emotionally and sexually so we can be happy in our relationships? How can we develop our talents and be of value to the world? We have interviewed more than 15,000 people and asked more than 4,000 different questions. After 20 years of intensive research, we are beginning to find the answers we have been looking for so long. We have already presented these answers in 250 research papers and about 30 books. Now we bring it all to you. In this paper on Hippocratic pelvic massage, also called Acupressure to the vagina, Professor Søren, Professor Hatimoma, registered nurse Birgitte Clausen and myself describes an ancient technique that has been practiced by physicians for 2,500 years. It was first described by Hippocratic 500 before Christ, and he said that this was the standard procedure to women who suffered from gynecological problems, sexual problems and mental illnesses. So this was really a tool, like a universal tool for women with a vast series of problems. The reason for using it for mentally ill patients, hysteric patients, is that the Greek doctors understood mental illness as a disturbed sexual energy. They said, when the sexuality goes to the mind, then you become neurotic or psychotic. If you're just keeping your sexuality in your body, close to yourself, then you are healthy and happy. And it seems that this is correct. This is basically the essence of psychoanalytic theory, of psychodynamic theory, of most theories on bodywork, that sexual energy should be in the body, not projected into the mind. In the book Evidence-Based Physical Therapy for the Pelvic Floor, Professor Kari Bøe from Norway describes that this is a well-documented cure for pelvic pains, for all the sexual problems like lack of orgasm, lack of sexual interest, lack of excitement, lack of lubrication, etc. So we know now more than 30 randomized controlled studies documenting that vaginal acupressure or pelvic massage is actually helpful for a lot of physical and sexual problems. It hasn't been tested that well in the psychiatric realm. So the idea that sexual problems is closely connected to mental problems is much less studied. But we know from studies that include mental health as a factor that mental health is also radically improved with this method. If you ask how it's done, there are hundreds of different techniques, but the simplest is just like a pelvic examination, where the woman is examined, and the difference between a normal pelvic examination and vaginal massage is that the woman is exploring herself together with the therapist or doctor. So there are a lot of unknown places in the body that can be explored, a lot of tender points and spots that can be pressed. This is why it's called acupressure, which will release emotions and different sensations in the consciousness of the female patient. The rationale for using this technique is that the problems are normally caused by emotions held by the tissues and organs. And this means if you have sexual problems, the most normal reason for that is feelings and emotions associated with sexuality, like shame, guilt, disgust, etc., which are held in the tissue. It means that the tissue around your genitals, around the vulva, vagina, uterus, are actually holding on feelings. So the moment you put your attention there, your consciousness there, then the negative feelings associated with the traumas and negative beliefs are released to consciousness and can be processed. So it seems that pelvic massage is the most direct way to work with the problems around the genitals and sexuality. Of course there are problems with it because it's a very, very intimate and confrontative procedure. So we recommend that the ethics are taken into focus and consideration. We recommend the ethical rules from the International Society of Holistic Health or similar appropriate ethical rules.